Anand Ranganathan, let me ask you first. Lockdown definitely has been showing results in the control we've had on the number of cases. I want to ask you, Dr. Anand Ranganathan, at this point in time, whether an extended lockdown beyond the 3rd of May, for which we are currently waiting, if it goes on till 15th of May, we will be COVID-free by 15th of September. But if we extend it to 30th of May, we will be COVID-free by mid of June. Do you think this is a price a country like India can actually pay at this time? Because every extension of lockdown will come with an economic cost. Where do you stand on this?
Yeah, thanks very much, Navika. No, actually, I don't think we can pay this price. But first of all, I want to congratulate you and Dhrubo and the entire team for these excellent models and projections. I especially liked RO assumption as well as the BCG assumption. But can I please give a couple of points from my own side? Beyond plain tabulation of COVID positive cases, their analysis or charting is quite meaningless for three reasons. One, increase in cases doesn't necessarily mean infection is spreading, because cases depend on testing. New cases of today could have been tested 3 days ago but weren't, in which case the rate would have dropped today and we'd have said the infection is decreasing. Two, death rate is defined as number of deaths by number of cases. So low case number means high death rate, and this creates panic. Right now we have 437 deaths and 13,387 positive cases. So our death rate is 3.2%, which is very high. Three, fitting country-specific data into the so-called Wuhan expat model published in the reputable Lancet, German scientists have determined the global detection rate, and they believe it to be on average 6%. In the case of Korea, it is 50%, but for India, it is only 1.68%. Even if you were to take it as 6% for us, we are detecting 16 times less COVID cases. This means we have a huge number of cases we aren't really picking. Silver lining, of course, is that our death rate then becomes 0.4% and not 3.2%. Thing is, this issue cannot be resolved by testing more through RT-PCR tests, because those are only tests we are doing. Some want them to be increased manifold. Well, we have increased them manifold in the past 3 weeks, from 3 per million population to 220 per million population. But here's the thing, of what we have tested, 302,956 samples, the positive cases are lowest percentage from amongst all nations that are testing in large quantities, 4%. In the US and Italy, it is 20%. This could either be because of one, as your models also suggest, differencing in sampling methodology, or two, COVID hasn't yet gained a foothold in India even after 3 months, highly unlikely, or three, Indians have a higher base level immunity because of BCG or exposure to environmental mycobacteria, or four, Indians contracted COVID in large numbers but got cured without knowing they had contracted it, or five, the lockdown came just at the right time. It is my view that the reasons might be 3, 4, and 5. In any case, more such testing might be useful, but not by much. What we really need, if I can have 1 more minute, please, because this is important. What we really need from now on is antibody testing. Without the antibody test, we are traversing a tunnel blindfolded and frightened, because we simply do not know how many of us have already had COVID and got cured. Last week, for example, Germans conducted large-scale antibody tests on a town and found 15% population had contracted COVID and is now immune, or at least showed the presence of anti-COVID antibodies. RT-PCR test showed only 2% had COVID. So in a single stroke, one, 15% of the population can re-enter workforce. Two, those with symptoms or presence of viral RNA can be isolated, thus limiting viral spread. And three, the death rate came down from 2% to 0.4%, quelling panic. Of course, since it takes some time for our body to generate the IgM antibodies, the kit cannot work in the initial week post-infection. But after that, the sensitivity shoots up, and so does specificity when the IgG antibody is also detected, and there is an overlap. RT-PCR